If you are pregnant and you notice watery discharge, your first reaction might be to panic. And honestly, that reaction is understandable. Sometimes this kind of discharge is completely normal, and other times it might not be. The tricky part is that in the beginning, both situations can look almost the same. So in this video, I'm going to walk you through what usually falls within the normal range, what might not be normal, and when it's a good idea to get checked out. And here on this channel, we talk about pregnancy, women's health, babies, and life as a mama. So make sure you subscribe and then tell me in the comment section if you're pregnant and how far along you are. I really enjoy reading your comments, so let me know down below. Now, let's get back to the topic. A lot of pregnant women tell me they begin to notice discharge that feels thinner than what they were used to before pregnancy. It may look clear or slightly milky, and it can leave your underwear feeling damp during the day. Some women say they feel like they need to change their underwear more often, or that things just feel wetter than usual. And many times, this feeling becomes more noticeable when you're moving around, walking, standing, or just being more active during the day. One reason this can feel a little unsettling is because it's different from what you experienced before pregnancy. So if you've noticed this change, just know that you're definitely not alone. So what's actually happening behind the scenes? Leukorrhea is the medical term for normal vaginal discharge. It's mostly made up of shed cells and tissue from the vaginal lining. During pregnancy, your body sends a much larger amount of blood flow to the uterus and vagina to support your growing baby. Because of this increased circulation, the tissues produce more fluid, and that can change the way discharge looks and feels. Pregnancy hormones also influence cervical mucus, which can make discharge more noticeable than it was before. And here's the interesting part. This is actually your body's natural way of protecting your baby. The extra discharge helps keep the vaginal environment healthy and also helps protect the uterus from infections. So having more discharge during pregnancy is usually a sign of increased circulation and protection, not a problem. You might also notice that discharge can change from day to day. Some days you may barely notice it, while other days it can feel like there's quite a bit more. How much you notice often depends on your activity level, how well you're hydrated, and even the position of your baby. But I do want to make one thing very clear. Just because watery discharge during pregnancy is often normal, it doesn't mean that every type of discharge is normal. Thin, clear, or slightly cloudy discharge that doesn't have a noticeable odor is usually just normal vaginal discharge, also known as leukorrhea. That's typically what we're referring to when we talk about watery discharge during pregnancy. But discharge that looks very different, like green discharge, thick white chunky discharge that looks similar to cottage cheese, or discharge that has a strong, foul, or fishy smell, can be a sign of an infection and should be checked out by your medical provider. This is a separate issue from normal watery discharge, but it's still very important to pay attention to. So if the color, texture, or smell seems clearly unusual or abnormal, that's a good reason to reach out to your healthcare provider. Now that we've talked about what normal discharge usually looks like and when discharge itself might need evaluation, let's compare watery discharge to amniotic fluid because that's what most women worry about confusing it with. First, it's helpful to know that for most women, the water doesn't actually break before labor begins. At full term, this only happens in about 8 to 10% of pregnancies. Most of the time, contractions start first, and then the water breaks later during labor. In some cases, it's even broken by a medical provider during labor with a simple procedure called an amniotomy. When amniotic fluid leaks, it usually follows a different pattern. The fluid is often clear or very pale yellow, sometimes described as straw-colored. It's typically odorless, or it may have a slightly sweet smell, not musky and not like urine. And it's interesting because movies often show the water breaking as a dramatic gush, but for many women, it's actually more like a steady trickle that continues over time. Amniotic fluid tends to be continuous. It usually doesn't come and go during the day. If fluid is leaking, you might notice that your underwear or pad keeps getting wet even after you change it. And this can happen whether you're resting, standing, or changing positions. So what can you do if you're not sure? If you think your water might have broken but you're unsure, the first step is to go to the bathroom and empty your bladder. Late in the third trimester, with the baby pressing on your bladder, small amounts of urine can leak out, and believe me, this happens more often than you might expect. After that, put on clean underwear and place a pad, not a tampon, but a pad. Then lie down and rest for about 15 minutes. When you stand up, pay attention to what happens. If you notice a small flow of fluid and the pad becomes wet, that can suggest a slow trickle of fluid that was pooling in the vagina while you were lying down and then released when you stood up. And since you already emptied your bladder, you know it's not urine. If you think the fluid could be amniotic fluid, that's the time to call your medical provider or the labor and delivery unit at your hospital. And if you're not sure, it's still a good idea to call your medical provider and talk it through. Evaluating fluid is something OB offices and labor and delivery units deal with all the time, so it's very routine for them and it can be very reassuring for you. Now, if you're wondering whether your water has broken, there's an easy way to remember what to look for. TACO, T-A-C-O. T stands for time. When did you first notice the fluid? A is for amount. How much fluid did you notice? C is for color. Was it clear, green, brown, or something else? And O is for odor. Was it odorless, mildly sweet, or did it smell different? It's also important to pay attention to your baby's movement. Your baby should continue moving the same way they were before your water broke. If you notice that your baby isn't moving as much, that's something you should call your medical provider about right away. So again, if you think your water may have broken, call your medical provider or the labor and delivery unit and explain what you're noticing. They'll help guide you and let you know if it's time to come in and be evaluated. Timing matters because the risk of infection slowly increases after the water breaks. This doesn't mean it's an automatic emergency, but it does mean that care decisions may change as time passes. If you're full term, meaning 37 weeks or later, you'll usually be asked to come in for an evaluation. Most people go into labor within about a day after their water breaks. If your water breaks before 37 weeks, that's considered preterm, and it's called PROM, or premature rupture of membranes. In that situation, you're usually evaluated sooner so your care team can monitor you closely. Preterm rupture of membranes doesn't always mean that delivery has to happen right away, but it does require careful monitoring and supportive care. And this brings us back to watery discharge and why patterns really matter. Most watery discharge during pregnancy tends to come and go, and it often changes depending on your activity level or the time of day. Amniotic fluid usually behaves differently, so paying attention to how things change over time is often more helpful than focusing on a single moment. Thank you for watching.